Tiffany Taylor, and I'm from Houston, Texas. If Ivanka Trump had a twin, I would be it. Tiffany Trump. A little over a year ago, I separated from a 10-year relationship. During those 10 years, I always knew that I was gonna have plastic surgery, but it was put on hold. I ended up giving a lot of my time for somebody else and not for me. So I knew there was bigger and better out there for me, and I was determined to find it. When I started following Ivanka, it was because I was really interested in her fashion and her lifestyle. She's very strong. She pushes for women's rights. She has her own business. She's so all-American beauty, and her nose is a very American nose. I like her cheeks and her forehead, her eyebrows. Ivanka to me is a role model to all women. I just naturally fell into wanting to be like Ivanka Trump because we have a lot in common. About 8 months ago, I started on my plastic surgery journey. Luckily, I was able to find a doctor to help me right away. Before the surgeries, I was super cute and adorable, but you know what? I didn't want to be cute, I wanted to be hot. I gave my doctor 4 pictures of different angles of Ivanka. I started out with bigger breasts. I had like nothing, not even an A. It was like just skin. I got 350 cc's. I got grafting in my cheeks, lipo in here, lipo in my stomach. I got lipo in my butt. I got bigger breasts from 350 cc's to 600 cc's. These are huge. Have y'all ever had heavy breasts? It's totally different. And then I got lipo in my arms, an eyelid lift on the top and on the bottom, and then my nose. All in all, I've had 13 plastic surgery procedures. Unfortunately, with my nose job and my eyelids, that didn't go so well. My nose has a bump on it now. I am very confident that Dr. Dubrow and Dr. Nassif will be the doctors that will help me cross the finish line to get to where I want to be. And I am determined and I am beyond committed to look like Ivanka Trump because I'm never gonna quit.
So let me tell you about our next patient. We have a young lady named Tiffany. She is on a quest to look like a celebrity. So here she is.
She's cute.
Attractive lady.
Mm-hmm. What celebrity do you think she's trying to look like? Britney Spears? Christina Aguilera?
I have no clue, no.
I'm saying a pop star. Some pop star she's trying to look like.
I'm gonna say an actress.
So she obviously has a significant problem, otherwise she wouldn't be here to see us.
So I wonder what that problem is, and let's just see her then right now. Can you please send in Tiffany?
Hi.
Hi, Tiffany.
How are you?
Tiffany, hi, Dr.
Nice
Nassif.
to meet you.
Oh, we get a kiss. Oh, look how sweet.
Hi, Tiffany. How are you?
How are
Terry.
you?
Nice to meet you.
Here. Okay. I am here today because this is what I represent to the world, and it's gonna be perfection. And beauty is important, just as brains.
We know you want to look like a certain celebrity, but we don't know who it is.
Ivanka Trump.
Tiffany doesn't really look like Ivanka Trump. She's more like an Ivana. Ivana thinks she looks like Ivanka Trump, but she doesn't.
How did all that happen?
How did it all happen? She's very elegant, classy. She represents women, and she's a go-getter, and
That's for
she's
sure.
positive.
You mentioned all these personality traits,
Correct. Yes.
right?
Yes.
So you want to be like her, but you also want to be like her physically.
Yes. Her classic all-American features.
So Tiffany thinks Ivanka has all-American features, but isn't Ivanka's mom from Eastern Europe? I think she has her facts a little messed up. Did you vote for Donald Trump?
Of course I did. Yeah. Oh
Right.
gosh, it's like in the heart. Yeah.
Okay.
Sorry.
So you're happy he's president?
Super. Yeah,
Yeah.
This is what our country needed.
So what procedures have you had?
So I've had 13 surgeries.
Oh my God.
In what period of
And
time?
I was so pretty before, but I'm just more elegant now. Almost a year.
Were you put under anesthesia 13 times in the last year?
No. 3.
Oh, okay, so multiple operations done at once.
Correct.
In plastic surgery, sometimes we do multiple procedures. Now, they may be small, but you can have up to 5 or 6 procedures at one time, as long as it's safe.
Why are you so serious like that? That is so funny. You're like...
Well, I'm pondering this conversation for a minute of trying to figure out why would you want to do that much of a transformation that quick?
Are you married?
No.
You're single.
I was married for like 10 years, but
Oh, really?
no, I'm single.
How long after you broke up did you start having these surgeries?
Oh, like 4 to 5 months.
It is very common for people after a traumatic event or a breakup to come in and want to have plastic surgery, but you have to be very careful of those individuals that they're doing it for the right reasons and that they don't have unrealistic expectations. That can be a real red flag. And unfortunately, now you have some problems with them. Which ones have been a problem?
My nose, I was like going back to fix the bump, and then there's another bump. And then every time I get my wax done, they're like, what happened here?
Just out of curiosity, in the future, what more do you plan on having?
This, and this, really.
So this is it then. So you want to actually have us take a peek at these things to see what we think?
Yeah.
Yeah.
So why don't we go in the exam room? Obviously, we're not going to help someone surgically try to look like a celebrity. But Tiffany's had a lot of plastic surgery, and if there's anything we can do to help any of the problems she's having, we're willing to help her. So did you have 2 nasal surgeries or just 1?
2.
Will any of them have a little cut right there?
No.
What was wrong with the first one that you needed the second one?
There's still a bump, and then he tried to get it off, and then he's like, hopefully there's not a bump this time, and there was a different bump.
How many months has it been since your last surgery?
3 or 4 months.
3 or 4 months
Yeah.
since your last nasal surgery.
Okay, so we're gonna just touch your nose. Gonna feel.
The bump that bothers me is right here. I want that.
So you want a scoop?
I want a scoop.
Oh, you want a scoop? How nice. Okay. I'm not gonna give Tiffany a scoop nose. That's ridiculous. That's unnatural. Okay, your septum is nice and straight in there. And it may actually affect her breathing. Let's talk about your nose. First of all, you just had a surgery 3-4 months ago. You keep going back in your nose, you're gonna cause some serious damage. You have to, first of all, you have to let the nose heal about a good year. So we're gonna kind of urge you not to, because this looks great on you right now.
I know I have a great nose, but improving is super important, and we should all improve ourselves, and I'm not gonna stop until I get it.
Your incisions are different for your upper eyelids on both sides, but this one is more visible. It's a little red line.
Yeah, it looks like a wrinkle.
You know, and that one for the red line, you can just even laser. Okay,
Really?
that's something, you can just laser that little red line if you want to. Tiffany does not need an invasive procedure. All she needs to do is go to the dermatologist, maybe have a laser to get the scar to go away, or maybe just give it time to heal. It's only been a few months.
If you have more plastic surgery, the chances that you run into a significant complication are huge.
Ooh.
That was good. I liked what you said there.
Huge. My suggestion for Tiffany is to forget about trying to look like Ivanka Trump. Go home, relax, take a beat, and maybe think about doing this sometime in the future. Maybe, I don't know, in 4 years. Plastic surgery has evolved to a much more natural look. I think you're there.
I mean, you don't need anything right now.
Your journey to look like Ivanka Trump is over. You're
Oh,
good.
just stop
You're-
it.
yeah,
I'm
seriously.
Tiffany Trump.
You're Tiffany Trump. So basically, Tiffany is already great.
Tiffany's amazing.
Tiffany doesn't need to be made great again,
Leave your,
right?
make Tiffany great again.
No, Tiffany is great.
I'm just looking to be greater, of course. Is it everybody?
Pleasure.
Awesome.
Pleasure meeting
Great
you.
meeting you. Thank you.
Good luck. Safe trip back to Texas.
Thanks, guys.
My name is Roy, and I'm on the quest for the perfect Michael Jackson nose. Hee hee! I grew up in a small town in eastern Kentucky. My household growing up was religiously strict. No television, no Christmas. Halloween? No, that was the devil. I felt trapped. What got me through it was Michael Jackson's music. I would have my Walkman and dance on the railroad tracks, and would dream of the day that I would leave that place that was torturing me. Michael Jackson's music gave me hope after he passed. I wanted to bring that joy into someone's life. I decided to dress like him, dance like him. We started doing, some little charity shows, and people loved it. But I thought, you can't be Michael Jackson if you don't have that nose. I mean, it's just the perfect sculptured, created nose. It's art. So I contacted a surgeon, and I told him I wanted to look like Michael Jackson. He was shocked, but he thought it was interesting. He never met anyone like that. He agreed, and he did it. I was satisfied at first until it started changing. The tip of it would shift sideways. Everything was uneven. It was just totally off. If Dr. Nassif and Dr. Dubrow could give me my Michael Jackson nose, That would change my life. I want people to look at me and have to take a second look.
Hi, welcome.
Hello.
What are we looking for today?
I am looking for a wig that looks like Michael Jackson's wig.
Oh, okay.
I came out to LA to see Dr. Nassif and Dr. Dubrow. I've never been out of Kentucky, and I'm going to take advantage. I impersonate Michael Jackson.
Okay.
Yes. And so I need new hair.
Awesome.
Too short.
Uh-huh.
Yeah, this is a no.
No? Okay.
Yeah, I'm not feeling this one. I'm a perfectionist. I pay attention to every single detail as close as possible. I don't like the highlights. I won't step outside if it's not right.
So what made you want to pursue Michael?
I've always been a fan of
Okay.
Michael. I mean, he was just the most talented man, you know, in the world. And his look was amazing. He was his own work of art. I want that Michael Jackson nose. Yes. I love it.
I think it's the one.
It screams Michael.
Yeah.
Yeah. Perfect nose, perfect hair.
Yeah.
Roy is a Michael Jackson impersonator. He took his nose already to have a Michael Jackson nose.
Yeah, reductive rhinoplasty.
Reductive rhinoplasty. Let's take a peek at his nose. That can't be him.
This guy's a middle-aged white dude.
Obviously, he does not look like Michael Jackson in these photos. Collapse in the nostrils, no airway.
He's on his way to a Michael Jackson nose anyway.
Will you please send in Roy? Michael,
Yes.
Michael!
Dr. Nassif.
how are you?
Very, very well.
Dr. Nassif.
Thank you.
Wow! A Michael Jackson impersonator comes in, and sitting next to me is Bubbles the chimp. Can you show us the moonwalk real quick?
Yes, I can.
Wow.
I've got the moves that Paul can only dream of. How much surgery have you had related to looking like Michael?
I never did like my nose. It was just huge. So I found me a surgeon. He's like, I will do it for you.
Okay.
I got to think about the motives behind this doctor. What ethical doctor would do something like this?
So he did what you wanted him to do.
Yeah, and it looked fabulous at first. Over time, it was worse than what it was.
If you had a Michael Jackson nose, what would that do for you?
It would make me more realistic. That's what I want, to be more realistic. I want to look just as authentic as possible.
Some people consider Michael Jackson to be a nasal cripple. May he rest in peace, you know?
Right.
He couldn't breathe.
And most of his nose was pretty much gone.
Pretty much gone.
Yeah. Is that where you want to go with that?
As close as possible. I didn't see Michael Jackson as being a nasal cripple at all. No, I see him as art. He was art.
Your nose right now, you don't think it's small enough?
Not to be Michael.
The best thing for me to do is to take a good look at your nose.
Sorry. Yes.
Clearly, we're not going to give Roy a Michael Jackson nose. The real challenge is to show Roy he could actually be doing some serious harm to the functionality of his nose. Whoa! Huh.
Let's actually take a look, okay?
Good.
Just over-rotated there, but not, I mean, this isn't bad here. I mean, it's a little, a little scooped, a little bit. Okay. You want nice Michael Jackson nose, right?
Right.
Okay, so that means we'd have to cut here again. So let's just go ahead and do this now. Tell me, breathe for me a little bit.
Ooh.
You like that?
It's a little rough.
Okay. The functional result will be you can't breathe through your nose. And if I can show him that, hopefully I can just get him to really rethink his choices. You actually did an incredible job with the makeup to give yourself like that real skinny tip. And the only way to make a tip look like that would be narrow all this and to also somehow defat the skin so that it would actually make those indentations like an implant. And try to compress the bones and the cartilage to make it really narrow. There's about a 99% chance that your whole nasal skin, the whole thing will just die. You won't be able to breathe.
Well, I don't want a dead nose. That's for sure. I didn't know anything that extreme could happen, Michael or not. I don't want a dead nose. I don't want to go that far.
Good.
And damage myself.
Of course, we want patients to be happy and look like what they want to, but if it means making them look weird or abnormal, I don't want to be part of that. If he wants to come back, have me reconstruct his nose, make it even look better than it looks now, I'm here for him.
Not at all.
Good job.
It will not stop me performing or looking like Michael Jackson. The rest I can still do with makeup and make it work. I'd rather have my nose.
My name's Brian Ray. My nose is the one thing holding me back from looking like my queen, Britney Spears. I'm happy with the tip of my nose. It's cute, petite, kind of feminine, but I really need my nose to be a bit more narrow to look like Britney's. I grew up in Woodland Hills, California. Whenever we would have family get-togethers, I would make everyone sit on the couch and I would get up and just start dancing and singing for my family and friends. And so that's when my mom was kind of like, I think there's something here. And I started with dance class and acting class and just performing ever since. Around 14 or 15 years old is when it really hit me that I wanted to be a performer for the rest of my life. And that's when I looked towards Britney Spears because at that time, she was the biggest pop star in the world. Britney Spears is the full package. She's sort of this like girl next door sweetness, but she's also super sexy. And she has a smile that literally lights up the world. It was about to be my 17th birthday, and I sort of dropped the bomb on my mom that I wanted to get a smile that matched Britney's. I wanted veneers, and at first she was kind of shocked, as I think any mom would be, but she was super supportive, and that was $25,000. Thank you, Mom. The results were unbelievable. It was like I was a different person. I had totally been transformed, and I knew then that, hey, if I could change my teeth, I could change anything. And I started with fillers and Botox and laser hair removal, chemical peels, and just anything that I could do, I was down to do it because I wanted to look like Britney Spears. When I was 21 years old, I went to my mom and I said, I'd really love to get my nose done and I want it to look like Britney's. And after the swelling and everything went down, I just wasn't satisfied with the complete result. The bridge of it is much wider than what Britney has right now. I was approached to do a little interview just about my look and my transformation. And I woke up the next morning and there's headlines around the world. Man spends $80,000 to look like Britney Spears. Because of all this media attention, I decided that it would be the perfect time to do a world tour. So we're gonna be putting on a show, and obviously it's gonna be centralized around Britney, but I'm also gonna be introducing some of my own music. Jonathan is my fiance. We've been together for 2.5 years, which in the gay world is like 20 years by now. And we are planning my dream wedding. With everything going on right now, planning my world tour, planning my dream wedding. And obviously I wasn't gonna do what Britney did for her first wedding. I'm not gonna go to Vegas. So now is the perfect time that I get my perfect nose for my dream wedding. How are you guys? Good to see you. Today, my dancers, choreographer, and myself are all getting together to go over a new number that we put together for the world tour.
All right, guys, let's do it from the top.
How are you? Good, for you? Good. My name is Vinny. Me and Brent have a lot in common in terms of him being Britney and me being an alien. We're both striving for a different picture. Whoa. Yes, mama. Yes. That's cool. Dr. Nassif and Dr. Dubrow gave me some advice to stay more natural with my nose. My perfect nose starts out thick from the nasal bridge and comes kind of more down to a point almost.
What you want to have happen, it's potentially dangerous and it won't actually work.
I will definitely say that I've taken more of a extraterrestrial on Earth kind of look, but always being galaxy realness. Slay. Slay. Oops.
Hey, good job, guys.
Yes! Hi, baby. Oh my God.
So glad you came.
What a
Just a little moment for you.
Thank you, baby.
Of course. Show's gonna kill.
Okay, you're coming, right?
Oh my God, of course. I'm bringing everyone I know.
Okay. And we have news. We started wedding planning.
Well, hi. Congratulations.
Hi.
You have so much going on.
And you know, my nose has been bothering me. So I'm going to Dr. Dubrow and Dr. Nassif.
We've talked about this several times.
Yes.
But what exactly did you want done to your nose?
Okay, I want the bridge more defined.
Okay.
I want it sharper.
Keep in mind, he's already had one.
I know. I've had about my nose worked on about 5 times. So I got you.
You have to do it until it's
perfect.
right for you.
Since you last saw me, I have had my cheeks, my brow bone, my lips, just, the normal alien maintenance. You are in such good hands. I've never had doctors be so honest with me about my transition to become an alien. They pushed me away, girl, but I have faith. I have faith.
I'm so excited.
And they're cute.
Are they?
Yeah, they're kind of cute. Like Dubrow, yeah.
Okay, I'm excited.
I feel it.
I have a great patient for you. Okay. Brian is obsessed with a certain celebrity.
Okay.
And Brian is on a quest to make his nose look smaller. So let's just take a peek.
Whoa.
Those lips have like 6 syringes of...
If I had to guess this point, what celebrity? I would say Justin Bieber, baby.
Well, what's the whole lip thing all about?
I don't get that. So it must be a female trying to look like. I'm pretty up on pop culture, and this guy doesn't look like anybody I know.
Can you please send in Brian?
It's Brian, bitch.
Now I know who it is. Oh, it's Britney Spears. Okay, I can kind of see it. Blonde hair, big lips. Yeah, no, I don't see it at all.
I'm Jonathan.
Jonathan?
Pleasure.
How are you?
Nice kilts.
Thank you very much.
Seeing Dr. Nassif, I'm like gagging. He is so cute.
You are a celebrity impersonator?
Yes, I do. Britney Spears.
How do you two know each other?
I just wasn't asked that.
This is my fiance.
Oh, okay. Talk to me about the kilt. First of all, you wearing underwear under there, I hope?
I like to wear it traditionally, thank you.
So you're commando under there.
It's 83 degrees outside.
I don't care how hot it is. I don't want your testicles on my chair.
Your chef was Britney's father, right?
Yeah, Jimmy.
Oh my gosh.
Wait, so you know Britney?
So I know the whole family. She
Okay.
came over for Christmas a few times and stuff.
Britney Spears did. Wow.
That is so sweet. Like Dr. Nassif, hook a girl up, invite me over. I could totally see it. Brittany and I sitting at the table together. This is amazing. We're gonna be like best friends.
When did the whole aesthetic procedure start?
It was right before my 17th birthday, and I went to my mom and I was like, I want veneers. My mom kind of was in shock at first a little bit, and then we saw a few doctors and found the perfect place. And it was difficult to find a doctor who wanted to do that because
Right. Yeah.
I'm so young, and they were
And
like,
they grind down your teeth to nothing.
Veneers are set for someone who's actually had trauma, lost their teeth, or someone with poor dental hygiene, or their just teeth don't look good. But you do that as an adult, not as a healthy kid.
My next procedure, I was 20, and I went to my mom and I said, I want my nose done. I just wanted the bridge of my nose more narrow, like Britney's. Found a doctor, and that's when I got my next procedure.
How did that go?
I just wasn't satisfied, and I kind of let it go and just sort of focused on other things in my life.
Okay, so you've never had anything else done to it yet.
I've had only one nose procedure, but then I've done a lot of other things.
Like what?
So I've done Botox since I was 21, which my mom took me for that for my first time as well. You're thinking like, who's his mom? His mom is so crazy. In my mom's defense, when I wanted to get it done, she spoke to me about it. I spoke to a therapist. She wanted to make sure that this was seriously something that I was committed to, and it wasn't just a phase. And 15 years later, I'm still as happy as ever with the decision that I made. What I really, really want is a new nose. And I'm really hoping that you guys could help me with it.
This area right here, the bridge?
Yes.
Not the tip. You're happy with the tip?
I'm happy with the tip. You know, some people say just the tip. I'm happy with the tip. So I want to leave that.
The best thing to do now is to get you in the examination room. We can give you our thoughts.
Okay, great.
I want to feel your bridge, okay?
Okay.
How many years ago?
I was 21, so 10 years ago. 11 years ago.
Good surgery.
Thank you.
Let me just, could I have a Headlight, please. Brian's doctor overall did a good job with the probable hump reduction and osteotomies. However, now he's starting to collapse in the middle vault, right here where the upper lateral cartilage is, and that's because when you fracture the bones, take down a hump, and you don't stabilize the middle part of the nose, it collapses. See how it's straight? And then you take a look right here. See how it's going in right there? So here's the issue. I can just explain this to you.
Okay.
Right now, if you go and have a doctor, even me who's done thousands of osteotomies, try to fracture your bones again. Here's what's gonna happen. First of all, the asymmetry here in your lower part of your nose is gonna become worse. And what's gonna happen is one side will just go and collapse in.
Oh my God.
So you have a high risk of having that happen to you. So besides it not looking great, your breathing will deteriorate, and guess what happens to all that dancing?
I can't dance.
You'll be going, and you'll be able to lip sync.
He's basically saying, leave Britney alone.
That's good.
Obviously, I'm a bit disappointed, but it's just not worth the risk. I respect your guys' opinion.
Oh, you're awesome.
So
Good.
I guess the nose is a no.
I'm so happy that you're not going to mess up your face, and we're excited about your tour.
How about I do a little move?
Little signature Britney thing?
Okay.
Oh, I want to see this.
So I'm gonna do from Oops, where the signature.
The last time I had someone dance in front of me, it was quite a different experience.
See?
Yeah, he got it.
My name is Haley. I'm 26 years old and I'm from Houston, Texas. And I want to look like Dolly Parton. Fish like shiny things, so I thought, why not dress the part and get more fish? I may look like a glamour girl, but I'm a country girl at heart. Going hunting and fishing and getting dolled up, that's not two things that people normally put together, but I just want to do what makes me happy. And I really love plastic surgery. But right now, I want to change the shape of my breast. Currently, I am more of a teardrop shape, and I would like to be more round. I want to have more of a fake look. I think the craziest thing I've done is alligator.
Did you catch it?
We caught the baby, but the mama was somewhere. We didn't know where the mama was. Froggin's fun too. When I was younger, I matured very quickly. Before I had any implants at all, I was a size D. They just weren't big enough. I wanted bigger.
What is the ideal goal?
2,000 cc's. I mean, it'll probably get a little bit harder on my back, but Dolly Parton does it, and she's like...
Your idol.
And she's a tinier frame than I am, then I can definitely do it, so. Growing up, I definitely loved Dolly Parton. She was shiny and sparkly and big and blonde. Just the drasticness in her body shape, like an hourglass, was a look that I wanted to look like, and I knew the only way that I could do it was through plastic surgery. I started my journey when I was 24. I've had 2 breast augmentations, taking me from 650 cc's to 1,200 cc's. And then I did the Brazilian butt lift. And I've gotten fillers and Botox. I'm hoping to have another breast augmentation taking me to 2,000 cc's, my nose done, another Brazilian butt lift, and possibly having ribs removed.
So I feel like this is gonna be a cycle that never ends.
It may. I'm not gonna lie to you and tell you that it won't.
Just as long as you're safe.
But I mean, as long as I'm happy, I think that's all that matters.
All right, so we have an interesting patient. Her name is Haley, and she's had very large breast implants placed. And she doesn't like this torpedo
This
in
toy is like a
shape.
torpedo.
So let's bring Haley in and see whether we can figure out what happened and how we can help her with the shape.
Sounds good. Can you please send in Haley?
Haley.
Hi there.
Hi, Haley. Dr. Nassif. Nice to
I'm
meet you.
Haley. Nice to meet you.
I know you are.
Terry Dubrow.
The first time I saw Dolly Parton was on Beverly Hillbillies, and that's when I absolutely fell in love with her look. It's what I want, so I'm hoping that they'll say exactly what I want to hear, which is that I can have my goal.
Where are you from?
Houston, Texas.
Texas.
Oh.
Texas.
Everything's bigger in Texas,
Everything's
right?
definitely bigger.
So obviously the first thing most people would notice about you is the chest area, but I focused on how thin your waist looks. Have you had any procedures to narrow your waist?
I've had a BBL to make my butt bigger.
Stand up for a sec. Do you mind? I want to see this. Because So you had fat taken from parts of your body and put in your outer thighs as well as the buttock area.
No, my thighs are all natural.
That's natural?
This is all natural. I had it taken from my stomach and all placed into my butt.
Wait a minute, what did you say?
Thick thighs save lives.
Okay.
I'm still trying to
process that one.
Have y'all never heard that one?
No.
Yeah,
So
what
in
does
what
that
way how do they save lives?
Well, down in the South, guys like curvier girls, and so they came up with the saying.
Thick thighs save lives.
Okay, so you want a change of shape to your breast, don't you? You don't love this. Your shape is a little bit over projecting. It's almost a little bit elliptical or torpedo-ish. Is that what you don't like
Yes,
about it?
That's how she describes it.
And that's what
And
you don't
I
like.
don't like it at all.
Okay, and you want more of a round shape.
And I want to go bigger.
You want to go bigger?
I want to go bigger.
All right, so tell us about your journey with this. I mean, you didn't go from 0 to this in one operation, did you?
No. So my first procedure, I went to 650 cc's. And about 3 months after that, I wanted to go to 1,200 cc's. And then a couple of months later, it looks like a scab or something underneath.
This was the right breast?
The left.
The left breast?
Yes.
Okay, and?
I went to the doctor, and I mean, he looked at it and instantly he was like, that's not a scab, that's your implant.
Oh, so your implant was being exposed.
Yeah, and he said there's a possibility I'm gonna have to take both your implants out. You're gonna have to stay without implants 3 to 6 months, and you're gonna have to recover.
That right there is the answer.
Yeah, that's the answer.
But I mean, me being stubborn,
Yeah.
I said I don't want that. I
Okay.
said any way we could get around that.
Okay.
Then what happened?
Within 2 days, we did an emergency surgery.
Took it out.
Took it out and then cleaned the area and then put a brand new one in. That we would.
Whoa, 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 whoa. Go back for a second. Took the contaminated implant out, put a brand new one in, blew it up to the same volume as it was originally, 1,200 cc's,
Same volume.
and then just closed it real tight.
Sewed me up.
All right,
And
that's a plan.
Then about 6 days later,
exactly right.
I
Feeling something.
wake up and the whole left side of my shirt just goes wet.
Yeah, yeah. Liquid coming out of an incision in the breast area, it almost always means that there's a leak from a seroma, which is inflammatory fluid, and the wound is falling apart. A total disaster.
So I called my doctor.
Yeah.
He said, I think you have an infection. He put me on some antibiotics. We did surgery and then took the implant out and put another implant in.
What size?
You kidding me?
1,200.
Oh, and that's that implant?
times.
That's this one.
OMFFG. That is just insane. Wow. We're lucky to be alive. Anything that survived those antibiotics was a resistant bacteria. If that resistant bacteria would have grown up, you would have had an untreatable breast infection that could have gone to your tissue. And that's how flesh-eating disease happened. That's the way.
How long ago was that?
This was going on 7 weeks ago.
Wait a minute, wait a minute, wait a minute.
7 weeks ago?
7 weeks ago.
Ah, I wouldn't be surprised the thing falls out while you're sitting here.
Don't say that.
You think it's over? 7 weeks? I mean, how long did it take you the last time you exposed from the surgery to exposure? How long was that?
It's about a month and a half out.
So 6, 7 weeks.
You understand that you're not
You're not out of the
completely
woods.
out of the
No
woods.
way. So the question is, what's going on with that left breast? Do me a favor, put your hands here and push. Yeah, you're still under the muscle. This is the side, okay. So this side, it's healed.
Not even red. And the incision actually looks
Don't have me
decent.
so nervous.
Haley's breast actually looks pretty good. There's no evidence of implant exposure or the development of an overlying wound, but it doesn't really get away from the fact that that surgeon took a big risk with Haley's life. In my opinion, your cowboy surgeon got away with the worst medical malpractice I've heard of in a long time, and we hear about medical malpractice all the time. But here's the truth. You naturally have a very short distance between the bottom of your areola and your crease. Because normally, when you do a breast augmentation, the areola is at least in the center of the breast. You have, on both sides, about 65 to 70% of your breast mount above the areola, and about 35 or 40% is below.
Okay.
Truthfully, at the end of the day, no matter what any doctor tells you, Haley, you can't have that round shape because you can't change Mother Nature as much as you want to when it comes sometimes to breast shape. And your breast shape is just a natural sort of conical, tuberous shape that will look more conical and tuberous if you go bigger and bigger.
It's gonna push it out more this way. It's not gonna go out that way.
And it'll push the nipples down more. So, are you done or are you not done? You gonna listen to me, Ish?
She's gonna continue.
Tell me what you're gonna do.
I don't know, honestly. I really will have to think about it, but I'm not gonna lie to you when I say that 2,000 cc's is what I want.
You're a perfect setup for a total disaster. If I had to, check all the boxes for someone who, if they go to the next step, will end up here, just saying, I just want to look normal again. You're perfect for a perfect problem.
It's very scary. I don't know. I truly want my best friend safe. Honestly and truthfully, where do you stand?
I don't know, I'm torn now. Well, I guess I have
Do
a lot
some
to think about.
research and thinking again. Well, I'm here every step of the way, just as long as you're safe.
Thanks, babe.